This is Africa TV, and once again, many thanks for joining us. And it's Friday. It's the week's ending edition, and of course, the month's and the final edition as well of the program. And we are very much happy to be back this morning. It's Friday, the 30th of July, 2021. Wherever you are, welcome and thank you for joining us again this morning. And as always, it's always a pleasure to be here to take you through in what will be a very interesting, interactive, but also informative edition of the GMA, that is the Good Morning Africa program on Africa TV. And tonight, or this morning I should say, we have a very interesting lineup, of course, to discuss matters happening in the country and beyond. And of course, we also expect a guest so we can discuss, as always, issues that also concerns the Gambians, and making you and I talk, always concern with regards to how should our beloved country move forward to develop. So we'll of course have an extensive or broader discussion today later on with our guest. So we'll be talking up today about matters of the National Assembly and health matters. The health minister was at the National Assembly to talk about some of the needs that the health sector, of course, apparently wants to, help or to boost the health facilities or the health sector in the country. We'll tell you about that in the report shortly. We also talk about the return of Gorgimboub as the anti-crime commander. The Gambian people have given their take on his reinstatement of Gorgimboub at the anti-crime unit of the Gambia Police Force. So we'll also bring you a report on that. We'll cross borders to talk about matters of COVID, in some part of the continent, the impact it has on so many things, including, travels and all that. So you stick around with us. And of course, once again, thank you so very much for choosing us again as we bring you the week's, final edition for the week as we get into the weekend. As always, we want to, end the week on a very high note, like I said. And on that, we expect you to, of course, as always, give us a great company, and I know you would do. And of course, keep interacting, get us your comments, keep them. We'll be very much happy to hear from you, as always, you do in this program. Mbokk yi ñu ngi leen di nuyu beneen yoon fii ci Africa TV ñëwaat mbégte dellusiwaat tey ci suba sile di leen waxaat juma mubarak di leen ñaanal jàmm fi ngeen mënta nekk ci biir réew mi ba ci biti réew tey di ajuma yem ak ñetti fukki fan ci weeri July 2021 su ko defee mu nekk édition bu mujj ci week bi waaye tamit moom mujj ci weeri July 2021 ñu ngi leen di nuyu comme mbégte lay doon xam ngeen ne saa su ne ñu ànd ak yéen ci jotaay bi ci fi ngeen mënta nekk kon niñ ko waxee ci biir réew mi ba ci biti réew ñu ngi leen di jaajëfal ba ci safoo bi waaye ci kóolute bi tey ñu fas yéene dégtal suñu ay xibaar comme nuñ koy faral di defee waaye tamit ñu sentu ci suñu ay gan ñu war a waxtaan ak ñoom ci tolluwaay réew mi waaye tamit xam ngeen ne xew-xew yi ci réew mi bari na ñu waxtaan ci loolu yëpp incha allah ci kanam tuuti bu yegsee ñu dalal ko ci point yu am solo waaye ci xibaar yi nañ wax ci aju ci National Assembly mooy pencum ndaw réew mi xam ngeen ne bu yàggu rek dem nañ fa dajaloo pour waxtaan ci sàkkuteef bi nga xamante ne nguur gi mu ngi ko doon sàkku pour ñu yokkale li nga xamante ne mooy ci dépense lu ñu war a dépensoo ci doxali ni réew mi bokk na ci wàllum wér-gu-yaram ministre bi nga xamante ne moom moo gàlloo wàllum wér-gu-yaram ci réew mi moom teewoon na fa dal di dëgëral ci sàkkuteef bi nga xamante ne health ministre bi ñu ngi koo def ci fan lañ ko dugal ak naka lay demee su ko defee nañ déglu ci ministre bi ci report bi ci kanam tuuti ci kaddu yi nga xamante ne dal na ko fesal foofu ci pencum ndaw réew mi leneen ci xibaar yi nañ wax tamit li aju ci Gorgimboub xam ngeen ne dellusiwaat na ci anti crime unit bi moom moo nekk seen commanda bi coow li bari na waaye Gambien si tamit àddunañ ci jot nañoo waxtaan ñenn ci ñoom nañ déggee ci niñ gisee ñëwaatam foofu ci anti crime unit gannaaw bi nga xamante ne jële woon nañ ko fii xam ngeen ne loolu juróon na coow su ko defee nañ ci ñëw incha allah ci programme bi ñu war a tamit séntu ay suñ gan kon ni ma ko waxee buñ yegsee ñu waxtaan su ko defee ponk yaa ngi noonu ñu ngi leen di gërëmaat bu baax a baax ci ni ngeen di ànd ak ñun saa su ne ci suñu ay programme waaye surtout programme bi di Good Morning Africa. So let's get started and we begin with matters of the National Assembly, as I said. Because during the adjournment debate on the supplementary appropriation bill, the Minister of Health made request to pave the procurement of nearly 100 ambulances for health facilities across the country. According to the health minister, the mobility package will complement the sector in its referral errands to address cases such as maternal mortality. Mariama Cham has more details of that in this report.
The country's health sector has been facing numerous challenges despite being one of the national priorities in sectoral budget appropriation. The confrontation is reflected in the lack of basic medical facilities, including ambulances, in different health facilities across regions. It is widely reported that the rate of maternal deaths is alarming, with instances of lack of access to health care at the right time. Certain communities rely on traditional means of transport in the form of donkey carts to ferry women and children to health centers in times of emergency. This leaves patients closer to death given the nature of road conditions and distances to cover before meeting a medical doctor. With 70 ambulances, Health Minister Ahmadulamin Samate noted the gravity of the health disaster will be suppressed.
These are the realities. Now, in Southern Combo here, a gentleman working in Banjul, the wife said to him she was feeling labor pains. The man said, wait for me, don't move an inch, I'm coming. Entered the traffic, 2 hours to get to the village. They tried to look for a taxi to hire. Before they go to a health facility, the woman died. So this has a direct bearing on maternal mortality reduction. It has a direct bearing on infant mortality reduction and on the survival of the citizenry of this country.
He told lawmakers in Banjul that his request for mobility is a mere amplification of the demand of the people.
The request actually has been coming from the communities and from your own honorable selves with regards to challenges that your constituents have been having in getting to health facilities. Building a health facility that looks like a hotel is one thing, but people getting to that facility is also a very important step. How do they get to those facilities without ambulances? I'm sure the honorable members, you ferry more people to the facilities than any citizen in this country with your vehicles, because when they have challenges, they run to you. We've all been doing that, women delivering in vehicles. It is a big challenge and it's not sustainable.
Lawmakers are likely to approve the call for support to the trained health sector, but not without a debate on availability of funds in government coffers. The demand by the health sector amounts to $134 million from a $1.7 billion supplementary budget request brought forward before the National Assembly by the Minister of Finance, would aim to fill gaps that could not be created by the 2021 national budget. Reporting for iAfrica News, I am Mariama Cham.
All right, Mariama Cham reporting there. Thank you so very much for that report on matters of the National Assembly. As you had the health minister there, and of course he is, I should say, requesting monies or funds from the supplementary bill to buy at least, there are about 100 ambulances to boost the mobility in the health sector. Of course, also to deal with issues such as maternal mortality cases and all that. So these are things that I think he deemed necessary for the request of these finances, and there has always been a concern in our health sector. More needs to be done to boost the country's health sector, of course in many other areas. So the government presented a bill to seek for more finance or funding. So it has been approved, but we'll come back to that in a greater details in our subsequent edition. But talking about this one, so of course 100 or 70 ambulances, I think it will be a good additional if that is approved, and then the minister or the Ministry of Health would have those ambulances distributed in different parts of the country, because if you go to some parts of the country, there are always a struggle to, for mobility or movement. It's always a challenge. So I think this is one of, or probably is the reasons why the minister wants to get these ambulances to, remedy some of those situations. Mu ngi noonu su ko defee comme ni ngeen ko déggee ci report bi rek ci tënk rek mooy ministre bi nga xamante ne moom moo gàllu wàllum wér-gu-yaram ci biir réew mi di docteur Ahmad Lamin Samate moom moo nekkoon ci pencu ndaw réew mi pour daal dëgëral li tax moom ministère bi sàkku pour ñu jox leen li nga xamante ne mooy koppar ñu mun a jënd ay ambulance pour tamit gën ko tasaare ci fu ne ci health facilities yi mooy ci hôpital yi ak béréb fajokaay yi ci biir réew mi loolu mu jàpp ne dana am solo su ko defee nag nguur gi ñoom ñoo daal di dem nag ci National Assembly sàkku pour ñu may leen yoon ñu mun a liggante xaalis pour mun a liggante yenn mbir yi ci réew mi doxalin bi ak yooyu mu ngi noonu su ko defee mu nekk lu am solo ñu am yaakaar tamit bu fekkee ne xaalis bi jot nañ ko dugal fu mu war a dem parce que loolu moo nekk concern si léegi te tamit coow li bari na ci wàllum health sector bi ñu bari jàpp ne lu bari mu ngi lampoñ ci secteur boobu te war nañ ko mun a yokk wala gan koo taxaw loolu dafay am solo bu baax a baax su ko defee ñu wéy gannaaw report boobu ñu dem fale ci biti réew. Of course we cross borders now on our next story and we head straight to Tanzania and talk about COVID-19. Finally the government have of course accepted the vaccines and have started rolling out the vaccination program. Now Tanzania's government has upped their game in the fight against the COVID-19 pandemic, with the president taking her first COVID-19 jab. President Suluhu Hassan has encouraged citizens to take the vaccine as the East African country became the latest nation to join the global fight against the pandemic. The health minister vows to raise public awareness to counter vaccine misconception after being criticized for downplaying its dangers with former President Magufuli. Here's more details of that in this report.
Tanzania's President Samia Suluhu Hassan has taken the COVID-19 vaccine. She and other high-profile government officials got vaccinated at the highly anticipated launch of Tanzania's vaccine rollout. Tanzania received 1,058,400 doses of the Johnson & Johnson vaccine through the COVAX initiative.
Let me assure you, my fellow Tanzanians, that we will make sure vaccine doses are available for those who want to get vaccinated voluntarily.
This rollout launch sees Tanzania join the global community in the inoculation exercise. Burundi and Eritrea are now the only countries on the continent that are yet to launch a vaccination campaign. With this launch, Tanzania is looking to vaccinate at least 11 million people in the coming months. The government says that along with the 1 million doses of the Johnson & Johnson vaccine, it is planning to import 5 other vaccines from other sources. At the launch of the campaign, Health Minister Dorothy Gwajima vowed to roll out a public education campaign to counter vaccine misinformation. Earlier this year, she had publicly dismissed COVID-19 vaccines, instead promoting natural remedies. Now, she says that those who claim former President John Magufuli was against vaccines had misquoted him.
What he said was the Minister of Health should not just rush to bring in vaccines without researching them and satisfying itself. Then all the expert editors out there decided to change his quote from the speech and decided to mislead people.
President Hassan is also urging the media to educate the public of the importance of receiving the vaccine.
So there you go. Tanzania's president has taken her first COVID jab, after, there has been a lot of talks with in Tanzania with regards to COVID-19. If you can remember, the late President John Magufuli, and of course, as you heard from the report, with her health minister, at the time, refuted or, downplayed the dangers of COVID-19. Instead of, taking or welcoming or accepting the vaccines, they opted for, the traditional healing sort of. So, but then finally, after, a long while, probably here now, the country, this African country, accepting the COVID vaccines, and the vaccination program has kick-started. And as you see from that report there, the president have taken her first jab with other top government officials, but also encouraging the citizens also to take the vaccines, to help the country combat the the pandemic. And interestingly, also the minister now is saying that he would be going out to counter misconceptions and about the vaccines, despite whatever she was criticized for standing by the president then at the time, the late President Magufuli, on downplaying or not taking COVID seriously. But finally, Tanzania has become the latest country to join the global fight. Of course, as you may understand, was Tanzania, I think, Burundi and Eritrea, if I'm right, were the only 3 countries who were to receive this COVID vaccine. But according to later reports, Burundi also have now agreed to receive the COVID-19 vaccine through the COVAX facility. So we only hope that it will have a great impact in saving the Tanzanian citizens, because everybody should encouraged now to take the vaccines, as the leaders have taken the lead. Equally in the Gambia here, we also, people are now going out in numbers to take the vaccines, and I think that's a very good sign. It's an encouraging sign that people are now heeding to the call after all the concerns that were raised at the time. Initially, the AstraZeneca vaccine arrived with the Sinopharm and all that, but now with the Johnson & Johnson, people are motivated because the numbers are really increasing by the day. With the latest report now, Gambia registered more than 100 cases. So that's also something that people are very much concerned of. But let's keep hoping for the best. And if people are taking the vaccines, that will be more of a protection, because it will prevent you. Maybe it doesn't mean if you are vaccinated also, just to be clear, you will not be contracted with the virus. But it's better to take the vaccines than not. So we move on from that, COVID-19 matters in Tanzania. Probably, of course, we do more COVID-19 news later on. But for now, let's report again or talk about the issue or the return of Gorgui Mbub as the anti-crime commander again. He was there before, of course, demoted and transferred to the other part of the country. But he's back. What does the Gambian view of his reactions? Let's have that now in this report. Now, anti-crime head Gorgui Mbub has been reinstated into office after over 10 months of suspension from the armed unit of the Gambia Police Force. His dismissal as head of the anti-crime followed public outcry of police brutality and subsequent condemnation of his leadership by the National Human Rights Commission. Now, they engage cross-section of the public on Gorgui Mbub's reinstatement to the tough job.
One Mohamed Job welcomed his reappointment on the belief that the country needed someone like Gorgui Mbub to combat crime rate.
Man, they anyway because the community needs security.
I appreciate Gorgui Mbub's work because this country needs security. It needs people who know the towns very well. And for Gorgui Mbub, he knows this country very well, especially Serekunda here. Him and Landin Boya, they know Serekunda very well. And the way things are, we need someone who knows the country very well, because nowadays thieves are all over the country. Breaking into people's houses is very common now. This is why people are even so scared to go out because of the thieves.
More than 20.
From the views of Dudunjai, anti-crime in itself is a good security unit, but the manner in which it operates needs to be properly defined and according to standards.
Why no operate modest? Because
I support anti-crime 100%, but the way they operate is lacking, because I know so many things that is going out there. For Gorgui Mbub, I have no problem with his reinstatement, but I know what happened to him before. He would not allow that to happen again. He needs to check himself properly. Human beings are so important, so if you walk in with them and they do something wrong, you can arrest them, but do not take the law into your own hands.
On the opposite side, Yankuba Toure maintained that the work of Mr. Mbub has never been good since the start of the anti-crime operations in the country.
correct, 0.0 for next minute.
Gorgui Mbub's work is not right. Nothing is good about it. All is poor. If he walks today, next day all is mixed up. What is not supposed to be done should not be done. Nobody should come and try to put out their own laws. The laws that the government has put in place, let all go by that. But if you put down your own laws, you are only trying to destroy this country.
Lawyer Martin believes that the reinstatement of Gorgin Boub as commander of anti-crime is another expansion for the country. If only he could add more force in tackling the crime rate in the Gambia.
Now, bringing him back to what they call the anti-crime unit, it becomes another development. However, for some of us, what we are after is to make sure that the current policing system to be smart and also to be effective. So if the police feel that since his transfer they have a problem or there was a gap, now bring him in, probably we will have to watch it and see again. But it may be also somehow a good development if at all he was in the judgment of the police that he is doing a good job like compared to before. So taking it as it is, as I say, as long as he can come and add more weight into make sure that we tackle crime in our communities, especially within the anti-crime and KMC regions.
Since the demotion of Gorgin Boub as anti-crime head, increase in crime has been a concern for citizens, causing many to doubt the capability of the country's security apparatus. This has led to the introduction of Operation Zero Crime, with the view to curb crimes in the country and ensure public trust and safety. The anti-crime unit, established in April 2018, is mandated to combat crime and criminal activities in the country. Reporting for iAfrica News, I am Daisy.
Daisy, thank you very much. So there you go. Interesting report there. Gambians, of course, react on the return of Gorgin Boub as the police anti-crime commander. There seems to be divided opinion on his return, by the way. For some, it's a good move. His welcoming is, or his coming back is welcome. They think it's the right move because he has been doing a very good job. So for them it's okay, but for others now, he should not have been back as the anti-crime commander because they were never satisfied with his way of work or the way he operates. But that's democracy for you, and whatever it is, people are always in different opinions, and I think that's welcoming, and that's why we accord them the opportunity to tell us what they think about Gorgin Boub's return as the commander of the anti-crime unit of the Gambia Police Force. And by the way, it was just because of the public outcry and of course the condemnation also of the National Human Rights Commission that led to his demotion, and then later been transferred to the upcountry. But after nearly barely 9 months or 10, so he's back again at the job, of course. So we all look forward to see what how things would pan out. So so people will be now, as one of them said, he's back, but it would not be as it was before for him. So he would also learn from what some perceive as a mistake or something that he should not have done, and he did that. So let's see how it's gonna work. So ko defee mbokk mu ngi noonu Gorgin Boub ñëwaatam ci anti-crime unit bi gis-gis Gambian si mu ngi noonu. Am na ñi nga xamante ne gis nañ ne war naa ñëwaat, waaye am na ñeneen ñi nga xamante ne ñëwaatam bi ànduñ ci, jàpp ne daal moom doxalinam doyut leen. waaye li ci mën a am comme ñëwaat na gannaaw bi nga xamante ne ñu bari tamit dañ joytu woon ne dañ ko fa war a jëlee. Bokkoon ci di National Human Rights Commission bi nga xamante ne ñoom tamit ci wàllum ak yella fi doomi aadama dañ ci dee taxaw bu baax a baax, wala loolu moo nekk seen taxawaay. ñoom tamit ñu defar ay recommendation nañ ko fa jëlee. Far nag nguur gi tamit wala police command hierarchy bi mooy kilifa yi déglu leen jëlee ko fa, waaye daanaka juróom-ñeent ba fukki weer ci kanam gannaaw loolu mu ngi ni ñëwaat na. léegi nag ku ne gaa yi joxe nañ seen gis-gis ci mbir mi, kon ni ma ko waxee xëy na gis-gis yi dafa wutee, waaye nag loolu dafa am solo. mbir moom xam ngeen ne lu munta am gis-gis yi du mun a nekk benn, foog ñu dem am ñu faree ni am ñu faree na le, waaye li ci munta am rek mooy ñëwaat na, te tamit foog ñu xaarandi ñu seet ñëwaatam bi lan lay jur ci wàllum sécurité ak taxawaayam ak taxawaay police bi nga xamante ne moom boobu la ci def coow li yëpp mbir mi du moom góor gi mbub waaye place bu mu jiitali ak doxalin liggéey bu mu faa def moom mooy wax ji léegi nag nit ñi foofu la ñu wutee gis-gis waaye li ci mënta am ñu seet naka lay demee ak fan lay mujj waaye ñu am yaakaar rek ne ñëwaatam bi na nekk lu am solo waaye xam ngeen ne jëfi crime bari woon naa ak yu mel noonu so mu ngi noonu waaye li ci mënta am rek origaay let's hope for the best ndax réew mi moom ñu ñoo ko bokk te ku nekk am nga ci wàll bu rëy moo tax ñu gis ne dafa am solo tamit ñu dégg ci ñi nga xamante ne ñoo ko ci biti te tamit ñu wax ci mbir mi ñu wéy wax ci leneen dañuy cross borders again ñu demati fale ci Nigeria wax tamit ci wàllum Covid bi jafe-jafe yi lu mu ci indi ci wàllum dem ak dikk bi surtout ci wàllum flights yi ak yooyu dafa mel ni jot nañoo yokkal li nga xamante ne mooy prices pass bi jur na nag coow foofu ci ñi nga xamante ne ñoom ñooy faral di use li nga xamante ne mooy air travel foofu ci biir Nigeria su ko defee loolu la ñëw àndal su ko defee ñu ñëwaat xam naa ne su fekkee ne suñ gan bi yegsi na rek ñu dugg moom ci waxtaan bi waaye laataa ñu see yegsi ñu ànd ak report bi den su ko defee ñu dellusiwaat. Let's get to our next story and report on the impact of COVID, this time in Nigeria, because the recent increase of airfares in the West African country has sparked dissenting views among passengers in Nigeria. The first increment is attributed to the surge of aviation fuel prices in the country. Now, the latest development could further plunge the industry as it recovers from the adverse effects of the COVID-19 pandemic. Let's have more details of that in this report.
These are not the best of times for passengers here at the Nnamdi Azikiwe International Airport in Abuja, Nigeria's capital, with the soaring cost of airfares fueled by a surge in the cost of aviation fuel, also called Jet A1. Passengers lament their ordeal.
I'm flying to Lagos. Today I paid 57,000 naira for a Dana flight to Lagos. But then it was not like that before. 3-4 months ago, it cost less than 40,000 naira.
Flight cancellations too have become rampant.
The fare for yesterday that I booked was 78,850, and then today now they are telling me 680,000 naira, and I don't have such money to book a flight ticket that I have already booked and it was cancelled.
In 2016, the Jet A1 was sold at 110 naira per litre. Recently, the price rose to between 250 and 300 naira per litre in the south and north, respectively. Several factors, including inflationary pressures, exchange rates, logistic challenges of importing and distributing the products, are responsible for the price hike.
In the last 5 years, the foreign exchange rate has almost doubled from about 215 naira to now over 400 naira at official window.
Airlines spend up to 40% of their operating cost on aviation fuel. Despite being the world's 6th largest oil producer, Nigeria is still unable to refine the product locally, making it susceptible to external forces.
What we can do, number one, is to give them special rates. Secondly, is to give them low interest bearing loans.
Nigeria's aviation industry lost nearly $500 million in the wake of the COVID-19 pandemic. The sector has been grappling to survive the many other challenges bedeviling it. Industry players say this could have dire consequences and pose a threat to the growth of the sector if not promptly addressed.
All right, of course, the impact of COVID-19, like everywhere, is taking its toll on different, issues and businesses and economies and all that. So as also same in Nigeria, fare increment or airfares increased due to, impact of COVID, of course, So that's why it is. And of course, Yes, passengers are complaining. It's very hard for them. So for some of them, they cannot cope with the situation, as we have been all witnessing over the past. Since last year, there has been an advanced effect, on the impact of COVID-19 in different sectors, in different countries around the world. So in Nigeria, of course, you talk about this is, one of the areas, that's the aviation industries that has been affected again, but it's not the first time. And the industry is struggling because of COVID, the impact of COVID since last year. And as they were about to, resuscitate the industry from the effects of COVID, this is another concern that came up, and now passengers might opt for another option instead of using the flights within and around Nigeria, and that might further affect the aviation industry in the country. So you can see how devastating it is that COVID-19 have brought for almost for everyone around the world, like I said. So we keep hoping for the best, but the best way to battle against this pandemic is to the health measures that have been outlined by the health professionals, and respect that, but also take the vaccines. That's the most important thing as we speak, because there's no medicine as of now, but we can fully rely on the vaccines and respecting the the protocols, wearing face masks, and also avoid social distance. Social gatherings, I should say. Let's observe social distancing, and all that, wearing face masks, and then if need be, why not go out if you can stay at home. So these are some of the things that we have to respect. I hope wherever we are around the world, to combat against the global challenge that we all face, that's the COVID-19 pandemic. Well, from that report in Nigeria, that will be the end of the stories for this morning. But of course, there's more to talk on this morning. So we should be taking a short break and come back with our guest to talk about issues happening in and around the Smiling Coast, that is the Gambia. We are heading to elections. This is the end of July, so we are getting into August, September, October, November. Probably we get into, not even probably, I hope COVID would not stop us getting into the campaign and all that. But of course, December 4th is the D-Day that all Gambians are looking forward to. So there'll be a lot of talking as we have been doing. Well, we'll talk more in regards to what we should expect, or what Gambians should look forward to expect before December 4th, but after as well. So yesterday, this CA party had outlined their 10 points for the Gambian people if they are given the chance to lead this country for the next 5 years. So that's some of the things that we expect more from other political parties. Other political parties are talking. Coalitions are being talked about, especially between NPP and APRC, which have been making headlines over the past couple of weeks or so. We talk about that and many other issues as well. This issue at the financial scandal in KMC also being talked about, and other issues also happening in the country. The president also spoke recently to the NPP media, I believe. So that's also, some people are talking. It's also making routes here and there. So interesting moments here in the Gambia, in case if you're away from home. But I will tell you, there's more interesting things that we will all look forward to as we get close to December. So stick around with us. We should be taking a break, and when we come back, like I said, we would welcome our guest, and then we get into details as to what we will be talking about this morning. It's Friday. It's the final edition of the week, but also for the month of July. As we get into the weekend, we would of course want to end the program on a very high note, like I tell you at the beginning. So don't miss it. Stay with us, inshallah. Mbokk yi dañ bëgg a jël short commercial break. Dellusiwaat ñëw continuer waxtaan bi kon ni ma ko waxee su ñëwaatee rek ñu war a dalal suñu gan waxtaan ak moom tolluwaay réew mi, xew-xew yi bari na, coow li bari na, te fuñ jëm nag xam naa ne ñëpp foofu la ñu bàyyi xel jamono ji mooy December 4th. waaye laataa loolu xam ngeen ne foog ñu waxtaan ci yu bari. Stakeholders yi bari nañ ci réew mi, foog ñu invite different parties, different individuals, and we talk. Waxtaan rek moo war a mun a am ci réew mi, inshallah. Let's take a break and come back shortly, inshallah, and by then we have a guest and we talk. So.
The locations, the design, the materials used, all the way down to the latest details, are few of many things that we focused on when we envisioned the airport residency. As proud innovators of community estates, the airport residency in Old Yundum, a project by Swami India International, offers unique gated community with 3 and 4 bedroom villas and duplexes. Just 5 minutes away from the Banjul International Airport. Luxury, convenience, and accessibility are some of the reasons you should consider this great housing opportunity. With a clubhouse, a playground, access roads, and parking facilities available for your dream home or a valuable investment, you will find all you need at Airport Residency here in Old Yundum.
Welcome to Staples, the office superstore for all your office needs, office furnitures, office equipment, office kitchenwares, office stationery. Get all you need for your workplace. Office desks, chairs, workstation, conference table, computers, printers, monitors, sofas, filing cabinets, water dispensers, microwaves, ovens, air coolers, and lots more. Staples, the best superstore in the Gambia.
From a vaccination stance, we invested a lot in technology, digital records. We have a Wellness on Wheels platform, and we've expressed to the government, we stand ready to help be a vaccination center. We have trained nurses and who could do it. So we want to be part of the efforts. Advocacy, speaking to our customers, because the benefit of a private facility is we have relationships with individuals that we know there's a level of trust. So letting them get access to the vaccine, we start ready to do that, to vaccinate as many people as possible. But also on the recovery end, our pharmacists and doctors have designed tools in terms of symptomatic relief medications for individuals who have COVID and are at home recovering. So the mass majority that might be sick but not sick enough to go to the hospital, InnovaRx is a good place to start to get virtual care, where we could do telemedicine with people in their homes to make sure they're doing okay, send them the right equipment like thermometers, pulse oximeters to manage from home. So I think it's two ways, both in terms of helping people recover and then vaccination, being willing to vaccinate as many people as possible.
All right, welcome back, and thank you so very much for being there, and as always for joining us. And like I said, we are in the final part of today's edition of the Good Morning Africa program, right here on Africa TV. And once again, wherever you are, thank you so very much for joining us. And it's Friday, so we should be, moving up, and of course, discussed on some of the issues, and we were waiting for our guests to be here so we can get started on what we should be discussing today. Like I said, we want to talk about issues happening in the country. You know, as always, we have been doing with our guest. There are so many trending issues in and around the country, as you know. Su ko defee rek xam naa ne ñu ngi ci li nga xamante ne mooy ci pàcc bu mujj ci programme bi tey ci lañu war a yeggas ci waxtaan ak suñu gan ci li nga xamante ne mooy xew-xew ci biir réew mi comme ni nga ko baaxoo di defee saa su ne buñ ci tolloo ci jotaay ji incha allah gan gi nag dafa xal na mel ni dama ragal mu am nu mu demee waaye léegi tey rek su fekkee ne yomb na rek ñu mun a door waxtaan bi waaye su dul loolu ñu leb ko tamit xam naa ne ba maybe hopefully next week incha allah ñu ñëw ak yéen ci loolu comme nuñ ko bëggee woon incha allah mooy ñu host ci point yu am solo ci tolluwaay ci réew mi. waaye waaw exactly waaye dafa mel ni xam naa ne dañoo mujj lépp affaire yi rek ci programme bi tey kon ni nga ko bëggee ñu bëggoon nag comme ñu ngi dem ci weekend bi ñu jaaxale mbir yi ñu am solo comme ni nga koy baaxoo di defee waaye xam ngeen léegi mbir mi dafay xala demee neneen te xam naa ne understand ngeen naka la su ko defee nag ñu dal di tàggatoo rek jox leen dig daje incha allah Monday bu ci yàlla àndee because waaw suñ liñ ko bëggee woon xal naa li fi ne noonu demeewut noonu waaye bu leen wari am na yeneen programme yu war a ñëw ci kanam tuuti rek incha allah yu war a interesting ci programme ci kër gi xam ngeen ne Eye Africa moom lépp li nga xamante ne lu war a bégal suñ viewers yi ak tamit yittal Gambien si loolu la ñoo dox ñu gërëm leen bu baax a baax ci ni ngeen di ànd ak ñun ci jotaay bi depuis buñ ko dooree ba léegi ak ci week bi Monday ba Friday ñu ngi leen di gërëm ci loolu di leen wax juma mubarak beneen yoon di leen ñaanal jàmm di ñaan jàmm ci réew mi tamit di leen wish a very 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 happy weekend waaw su ko defee ñu jox leen rendez-vous incha allah next week Monday. Well, viewers, I'm afraid that's all how much we got time for this morning's edition, and an apology. We wanted to extend the discussion as we have been doing, but yeah, we could not due to reasons. But it's good. We will be back next week, Monday, inshallah, with a brand new week, an edition of the program, so we can keep talking. Until we catch up again next week, do have a very, very splendid weekend. Stay safe, and remember, COVID is real and still around, and you keep safe. See you on Monday, inshallah. Bye-bye.